We're going to move ahead to House File 4017. Representative Johnson, if you would approach the testifier's table. I will move that House File 4017 be brought before the committee, and I will also move that House File 4017 be referred to the General Register. Representative Johnson, I believe we have a DE amendment. Would you care to explain the DE amendment to the committee?
Yes, thank you, Chair, committee members. The DE amendment is basically a result of a lot of work done on this, and what by many people involved. What it does is it basically changes the bill from what it was to what it currently is going to be more of a study, establishment of a study going forward, that then what the results will be brought forward next year. So instead of where it was, where there was a lot of angst with it, bringing it to a study that everybody agreed would be a good way to start this project.
Well, thank you, Representative Johnson. I'm going to ask you to just kind of briefly explain this issue, how it came to your attention, and why you think action is necessary. Not every detail, but a brief explanation, please.
Thank you, Mr. Chair. I'm sure everybody will appreciate the fact that we decided not to put up big bulletin boards here and show all the pictures that result of this. If you live in the Twin Cities and if you watch the news, I think both Channel 5 and Channel 9 has covered this, where it was happening, where surgery centers, hospitals were not sending and not separating their medical waste. And you can think medical waste is anywhere from body parts, blood, gauze, syringes, intestines, everything, skin. Basically, that's supposed to be put in a separate container and then sent it off to be disposed of. What was happening is during the cleanup process, they were just being thrown in the general trash. And so this has been going back for a few years now. This has been dealt with. This is a law, actually, that you had to do this separation back to 1989. What's happening is recently it's gotten to the point where it's not being followed. In fact, on a almost, the chair probably knows how many times, because I send him a text every time of pictures of what shows up at our local recycle and energy center. And again, this is where everybody in Washington and Ramsey County sends their trash. But however, this is a statewide issue. We have reached out to many other trash facilities, and this is going throughout the state, so it's not just a local issue. But it's a safety issue. It's a, what's happening, it's a safety issue, it's a money issue. You have workers, union members that are seeing this opening up a bag, and you don't know if you're supposed to call 911 because something, they just discovered a crime going on or what. But it's basically, people have walked off the job. It's a, you know, if you're grabbing stuff and there's needles and everything. So it's a safety issue, not to mention the county has to shut down the facility, or that facility has to shut down, basically because you have to bring in the cleanup crew, then you have to go into investigation who had did it. But if you've ever been to the facility and you've never been there, I do invite, I know they would invite you in to see the work that's being done as we try to divert 75% of waste from landfills. And if you go there, you're kind of see that the way the traffic comes in, you can't shut down. The facility does not shut down because it just backs up, and backs up if you consider how much trash is out there. So when this happens, they have to shut down. They have to bring in a crew. They have to bag it up. They then charge the county for it, doing that, and then they have to start the investigation process. So it's something that needs to be addressed. Attempts have been done many times with the different hospitals and locations, and they don't do it for a little while, and then they do it again. So what we're doing is originally try to put some more teeth in the bill. There already was a law, but in order to move this forward so we can start maybe getting to that goal, was start the study of why it's happening, how much is happening, who they need to educate and stuff like that, and that's kind of where we've got to this point.
Excellent. Well, thank you, Representative Johnson, for bringing this issue forward, and thank you for working with the various stakeholders to get to a bill that we can pass now. It's probably not the cure, but at least it's a step in the right direction. Any questions from members for Representative Johnson regarding this bill? We haven't done that yet. We need to adopt the DE. I missed that step. So at this point, I will move the adoption of the DE1 amendment. All those in favor signify by saying aye.
Aye.
Opposed? The DE1 is adopted to House File 4017. One more chance for member discussion. Seeing none, I will renew the motion that House File 4017, as amended, be referred to the General Register. All those in favor signify by saying aye.
Aye.
Opposed by the same sign. You're on your way, Representative Johnson. Thank you.
Thank you. I'd just like to thank Representative Heinzman, Representative Lilly for being co-authors on this, and everybody that worked with us to get the bill to this point that we can start moving and helping out. Thank you.
Thank you.